Thank you, Steve, and welcome to everyone that has made the time to come to this. AcuDetox, basically articular acupuncture, is been a long-standing practice for the last 50 years in the U.S. and actually as of yesterday was 35th anniversary for NADAD, which I'll be going over a little bit. So leading into this, just to give you some background information around AcuDetox. As I mentioned, acupuncture is normally used. It's an Eastern practice that's been brought over to the West. And the lovely thing around this is with Eastern practices, it was seen of not only being a alignment between the mind, body, and spirit, of instead of separating them, of bringing them together and aligning and making them kind of a flowing energy. There's some terms in here that we do use in AcuDetox that we have joined over from the Eastern medication, from basically the Chinese medicine of using the mind, body, and spirit, becoming whole, balanced, and equal. We use the life force term chi, and that's referencing of getting that alignment together between all three. Specifically in AcuDetox, we use specific points that are targeting the organs of the body and connecting into that mind, body, and spirit alignment. And with those, it's a helping of the balance of physical, emotional, and spiritual, such as liver being the physiological of physical liver, the mental, emotional being the anger, while the spiritual is the hope. And it's as they're stimulating that point, they want to get all three aligned together. And to get more specific around AcuDetox, being only 5 points that are within the ear, that's non-verbal, non-drug, non-sensual, and no barriers. So going a little further in this, of how AcuDetox came to the US was Dr. Wen, being a neurosurgeon there in China, had noticed people that were getting acupuncture following surgery were having less issues coming off of pain medication, specifically opiate addictions, because that was something he was seeing in his patients was pain medication, people getting addicted to it. And those people that were getting acupuncture, specifically in the ears, were noticing, okay, they're not staying on the pain medication longer than intended. They're actually tolerating it better with withdrawal instead of having a physical withdrawal response to it. This information was brought over to Dr. Smith, who was not only a person that helped develop, but also is our founder of the National Acupuncture Detoxification Association, thus known as NADAD, and that's how I'll be referring to it throughout the rest of this presentation. He was working specifically in New York City at Lincoln Hospital, which had a methadone detox program and clinic. And with this information from Dr. Wen, he was starting to see, was this another tool that can help people as they're trying to not only get off of pain medication, heroin, but the opium epidemic that was going on in the 70s. So as they were learning about this, fine-tuning it, and basically bringing it together and how they could best do what was needed for not only people in trying to battle this, but also as they're going through what we now know as MAT services, because there in New York, it was methadone, the earliest of medication-assisted treatment, to helping people of getting off and possibly even having a better chance of having a better quality of life, of noticing, okay, they're not having to stay on this medication for years on end. They're able to tolerate withdrawing a little bit easier. So AcuDetox has been always based in addiction treatment. And of course, as I said, this started in the 1970s, just celebrated 50 years this year. And then NADAD earlier this week, just celebrating their 35th year. Also, back to another big thing we always like to attribute to Dr. Smith is not only him being our founder, but him having the Lincoln Hospital being the first AcuDetox training facility and largest and longest running up until it closed in 2011. So having that long history of this is how much they believed in it. It even led to they no longer even needed the methadone clinic anymore there, and thus being strictly an AcuDetox training facility till the very end. A lot of people tend to get a little nervous when they hear about acupuncture, especially in the ear. AcuDetox, we follow a very close medical protocol of using fine, sterile, stainless steel, single-use acupuncture needles. As you can see in the photos here, of they are small, they do go into the ear, but also the wrappers of those are single use. They're not to be reused again and again or to be cleaned. It's once they're used, they are discarded into a sharp, safe container. And that way you don't have to worry about, are we worrying about transferring diseases, transferring other conditions when we're going to be following this strict protocol? And that is not only one of the things that Dr. Smith had done, he basically made it part of the NADAD 5-point ear protocol was single use. Another big philosophy we have with along with focusing on these 5 points, which I will go over them in the next slide, is that it's endorsement of we're trying to stimulate these points and encouraging the body to heal from the inside out in a natural healing ability. And it's again, aligning that mind, body, and spirit through these activation of these 5 points. So each point does have a function. This gets a little bit more into those that like to have the background for the 5-point NADAD protocol. Our first point being the very top, and I will bounce back so you guys can look at that, is the sympathetic. And it's, as you can see, the main function around this is for the stress reaction, that fight, flight, freeze response, basically preparing for action. Normally, also this helps connect to that central nervous system and communicating between the mind and the body. The next one is the shy men, which we always refer to as like the spirit gate. This is also where that term that I introduced you guys to in the beginning, that chi, basically that essence, the flowing within their body. It's to help stimulate of not only getting that brain body communication, but also to their spirit as well, of calming all 3 at the point and getting a person to ground and center themselves. Third point, the next 3 points, we actually do focus on actual organs of the body. Part of the reason being that they are detoxing organs, which is to help stimulate them, to help them with their detoxification process, as well as also the healing within the body. So the third point being the kidney. Normally, most of this we always see around a little bit more mental health will start coming out of this. Of we'll see imbalance of like the fear, the paranoia, low confidence, all of that stuff is coming out. And that may be another reason we start targeting these other points besides helping with detoxification from substances, but also balancing of what may be a mental health concern as well. The fourth point being the liver. We always see this as kind of regulating the blood and the chi, of trying to get them to communicate and to go back and forth. Another part that we've always seen with the liver of imbalance is if we see people that are more angry, rage, also a little bit stuck or obsessed, instead of just only being a liver for detoxification of the body, also seeing of this may be an imbalance around emotional regulations in these areas. And then the final point being the lungs, bringing air essential into our body and help taking non-essential out of our body. And again, back to the mental health of helping with the breathing, we may see more sadness, grief, lethargic going on as they're hanging on to this. So to go back to that photo you had seen, so you can see all 5 points, and I'll go through them again slowly. So point 1 at the very top is that sympathetic point, and that's going actually into the ear. The second one is the shy men. Third, up under that ridge, is the kidney. 4 is the liver, and 5 is our lung point. I've seen of individuals getting AcuDetox has been not only helping with basically detoxing altogether, but seeing about a withdrawal of symptoms, as well as also the cravings around addiction. Another thing that we've noticed, and this kind of starts bringing in the mental health aspect, is we start noticing an increase of calmness and better sleep and less agitation or anger. And seeing that people, as they are benefiting from this protocol, they're learning how to maybe even use some of these other skills that counseling's been bringing in, such as DBT skills of mindfulness, sitting with their emotions, and learning how to deal with that and being okay with that. Another thing that's been helpful is AcuDetox has been brought into individual and group settings. It's been beneficial of not only just being a standalone item on its by itself, it's normally been helpful bringing it into the counseling thing, as well as building a good rapport with the person and either the clinician, a medical personnel, or even someone that is just coming to help during a traumatic event. Some comments that I've actually gotten from individuals that have received AcuDetox with me is they said, I'm having disrupted sleep patterns that I find that this has improved. I'm feeling less anxious and experiencing improvement in my mood where I'm happier. Another person had told me, I'm happy I had less aches and pains in my body, and I'm more relaxed, having more energy now. So seeing that people are noticing that they're getting benefits from this, whether it was instantly after the first treatment they got, or if this was maybe the next or a couple days later, because every individual is going to be different in how they react to this, just like individuals are different on how they react to different types of treatments. The general research that's been done around NADAD, especially AcuDetox, has come to a big helping and identify not only with addictions, but also with the mental health component, and even started to develop even into the trauma area. So what they have found out with this of stimulating those points has helped the brain not only rewiring what's going on, but the communication within the body. So basically that physiological and psychological components are starting to work together instead of separately. Another good thing that's been pointed out from the general research from the NADAD 5-point protocol is that this is a very cost-effective and evidence-based treatment for harm reduction, addiction, mental health, and pain management. Since it got started in the 70s, it's always been tied to addiction, but it's been branching out with first responders, going to natural disasters, to those even being used in hospitals for pain management, for those that may be even going from surgeries, which Dr. Nguyen had even shown of those that were coming out of surgeries, of not only were they not needing pain medication for pain management, they're able to tolerate and actually even able to use some of their other tools around this. Research specifically around mental health and addiction. So one I actually pulled from locally in our area here, the Circle program that's down in Pueblo, which is a dual diagnosis 90-day program inpatient for mental health and substance abuse. They allowed volunteer patients from their program where they could get AcuDetox 5 times a week. From this, they noticed that they were getting increase of completion of program, those basically reaching the 90-day mark instead of dropping out, them developing better coping skills and management around mental health and substance use, and a decrease in cravings, along with stress. They also followed them up to a year later and noticed that at least half of them were continued in their sobriety, along with being clean from substance and compliance with the legal system, since a lot of the individuals that go through Circle are attached to the CJ system, whether that's from the jails, the prisons, or probation and parole. So that's a big thing. I know a lot of people say 50% isn't nothing, but when you see someone in addiction and mental health and in the CJ system, normally it's very low ratings for them to be successful a year later of not being back into either in the criminal justice system or having their addiction or mental health back in unstable conditions. Pulling a little bit from international use with using AcuDetox over in Sweden, They had a good amount of people actually participate in their program, and that they were reporting that they did have a substance-related problem. Then their program was about a year and a half instead of just 90 days. And they were allowing that they were able to get AcuDetox for 4 weeks while in that 18-month program. And they did base this over 2 of their facilities. Again, allowing individuals to come voluntarily if they wanted it, not being mandated to this. And for those that had at least completed 2 treatments per week, they were noticing that they were getting physical and psychological well-being, basically a decrease in worry and anxiety, less muscle tension, and even less drug cravings as they were going through the program. Another big thing that we've noticed is the research in trauma. So NADAD, specifically here in the state of Colorado, will get activated either by the American Red Cross or FEMA to come out for those of us that are ADS certified, basically acupuncture detoxification specialists, to help either our first responders or the community members that are suffering from the incident that happened. And these are the numbers that are actually from these events that have happened in Colorado, being the Walden Canyon fire, the Black Forest fire, the Aurora Theater shooting, and the Planned Parenthood shooting with first responders. They had reported after they had received their first AcuDetox session from ADS providers that there was less anxiety by 37%, less depression by 30%, a less craving for substance to manage what they just went through by 34%, less pain that they were physically feeling of 27%, less irritability of 32%, less headaches by 28%, and less nausea by 22%. And those are huge of just after their first AcuDetox following the incident that they were having to deal with as a first responder, because normally we were seeing more and more first responders deal with trauma. And a lot of them are having trouble handling their mental health afterwards, and even possibly trying to management with an addiction afterwards. And to go more on a national and international basis, AcuDetox being practiced in trauma. Ever since September 11th happened here in the US, AcuDetox was brought out there to help first responders and community members. This was to help them in being able to not only get out what they may have been breathing in to help their body heal from the inside out, but to be okay and to feel safe that they could just sit in a single place and just be able to breathe and relax, especially going through something as traumatic that we went through as a nation. As more trauma events keep happening, we've been activated to come out and help more and more to help address the traumatic stress with first responders. And the biggest part is to helping learn them to breathe again following this, as well as also to help improve that sleep that they're going to get within that first night, if not the next night. Because that's something we do notice is disrupted sleep for those that have experienced traumatic events, whether they were there themselves or that they were there coming in to help those that were in trouble. It's nice to know that not only the American Red Cross, but FEMA have been using this within the US as well as also outside of the US. So when they're starting to respond to international stuff, they want to bring individuals because they're trying to help those individuals in being calm, being able to have the logical thinking process that they're going to need as they go through the next unknown amount of time as they're processing from the traumatic event that's happened in their region. So normally this is how we've always explained AcuDetox to someone that's coming in that's going to get it. It's a nonverbal approach to healing. Involves gentle placement of up to 5 points, sterile disposable needles into a specific site on each ear that we went over. Basically being sympathetic, shy men, liver, kidney, and lung. The individuals sit in a group setting is normally how it's typically done. It can be done in an individual setting, but it's still going to be between 30 and 45 minutes to allow the treatment to take full effect. With the ear acupuncture, you can do this with therapy so that it's helping the individual, especially if you're trying to use like the DBT skills of learning how to emotionally regulate, sitting in silence, sitting with their emotion. Because when someone has acupuncture needles in their ears, we don't want them moving around. And that kind of helps the person understand they shouldn't be moving around, but they need to learn how to use that skill. The nice thing about this is we're able to adapt the NADAD 5-point acupuncture to several different sites, basically of we're able to do this within a behavioral health setting, addictions, disaster relief, in any location of a group of people that can sit together. The combination of this has been used in counseling, education, such as the school systems, the university systems, medical offices now, and even self-help groups such as AA and NA have been using this. A big part that I'm going to reference again from Dr. Smith is we're talking about the body wanting to heal itself. This comes from life. So you are choosing your own healing. Nature wants us to get it right. The biggest challenge we've had with AcuDetox has been during this whole COVID-19 health crisis. In the beginning, we were told to discontinue it because we were having to distance ourselves. We didn't know how things were going in the beginning. However, another part of AcuDetox is we use what's called seeds and beads. And this is on that second point, the shy men, and that's to help stimulate that point to help with communication with the mind body spirit alignment. This was something that we were able to disperse, and we didn't have to worry about an individual needing to be trained in how to do this, and we could do this over telehealth. So basically, and I do have some here, we were able to give our clients seeds and beads and actually help them in putting them in the right place on their ear, just to stimulate, and that way we can continue. As we got more information and also proper protocol, we were allowed to basically start doing AcuDetox with the acupuncture needles again, as long as we followed the health guidelines of everyone is masked, proper health cleaning of everyone washes their hands, the individual cleans their ear with soap and water and properly dries it prior to getting the treatment. So we have been able to go back to doing AcuDetox treatment, even in the current epidemic that we're facing. One thing we do have here is for those that are interested in becoming ADSs, it's basically going and getting a certified training here in the US by NADAD. We have actually 2 wonderful trainers here in the state of Colorado. One of them is actually our NADAD president. She's down in Pueblo. She was the former medical director over Circle for several years. And then we have an acupuncturist that's up in Denver. And you can find the trainings at the AcuDetox.com website. Normally with this, you'll have trainings. You'll also have the guidelines for the state regulations, additional tools, even where once you complete training, where you can go and buy your supplies so you can provide this resource to those that are needing this. I'm going to go a little bit more specific for state of Colorado. So to become an ADS here in the state of Colorado, it used to be that you had to be a fully licensed clinician, basically an LPC, LMFT, LCSW, or LAC, or unlicensed psychotherapist, which used to be a registered psychotherapist. However, with the recent Mental Health Practice Act of 2020, CRS 1245-233, has allowed AcuDetox to remove that requirement, so that now all you have to do is go get your NADAD training, which is about 70 hours with a registered trainer through that website. You can find them very easily. And it's being taught the proper protocol and training on how to do this, following basically supervision of a certain amount of time that's signed off. So that way, individuals, as long as they're doing this in good faith, they have the training and education supervision. You're now able to provide this to those that are requiring it. And then also at the very end is my contact information if anybody else would like to specifically know more about AcuDetox, how we're applying it as AspenRidge, or if you just have any other questions about AspenRidge in general.
Thanks, Kellyanne. That was great. I learned a lot, definitely not being an expert on this. We can open this up for questions if anyone wants to either type it in the chat or you're free to unmute yourself and ask away.
Hi, thank you, Kellyanne. Can you hear me?
Yes, I can.
Okay, just making sure. Sorry, I'm trying to find where I can see you all. I'll play around with it. Anyway, I'm in LPC LAC in Longmont. I used to work for a group agency that did AcuDetox. And yeah, I can totally say that people in group like felt really relaxed. And when I was about to start group, I can just say it had a relaxing effect.
Mm-hmm.
I've never experienced it myself though. I was just curious if you mentioned the research was generally around opiate addiction.
Mm-hmm.
I'm just wondering anything you may know about for alcohol and other substances, if the research or anecdotally people have found it helpful for those or a combination, which often happens as well.
So I'm going to clarify. So most of our background information is off of opioid. However, most of the programs that has research out there, these are individuals that are non-substance. So they're not, you can only go in there if you had opioid or alcohol. It was open up to anybody that had an addiction problem. So
Okay.
I know with like Circle was being down in Pueblo, they did see they saw heroin, they saw opium, they saw alcohol, they saw meth, marijuana. I know with the hospital systems, they've used this more with their smoking cessation programs and even in their oncology department for those that are not able to do pain management medications because of how it's making them even sicker. And then that brings up another problem, them getting treatment. Because if they're not keeping their levels at a certain safe area, they're not able to continue in their cancer treatments.
Gotcha. Yeah, I'm glad it's available and helpful for a lot of different things.
Mm-hmm.
Thank you again.
Any other questions?
This is Jane. Can you hear me?
We can hear you.
Yes, I can.
Oh, good. I just did submit 2 questions. One, I'm an RN and might be interested in learning how to do this. Could I do that by going through the NADA training and stuff?
Absolutely. So before the change happened with the mental health law, nurses were a part of that, doctors are a part of that. I know I actually had several nurses part of my AcuDetox training down there at Pueblo, and they all of us kind of did our supervision down there at St. Mary Corwin for their oncology department. So I know nurses are always encouraged to do this, same with doctors. I know there's quite a few that actually are part of that first response team that go out to the community and provide this as well when a natural disaster or trauma event happens.
Right. And this is just a total aside, but I didn't know the Circle program was back in functioning. Do you know how much that costs, or is that totally funded by Colorado?
So Circle program's been back in since last year, 2019, because they traded hands. It's no longer at the state hospital. They're out in the community. And as far as I know, and as this can't probably have maybe changed some information. Last I knew, it was free to the individual. That was funded under a specific grant to address the mental health and addiction problem that we find here in the state of Colorado.
So I mean, I could call down there. Anybody that qualifies can go without cost.
Correct. They wanted to reduce that barrier to them.
Great. Okay. Thank you very much. Very interesting.
I've got a couple of questions for you, Kellyanne. You mentioned that this was pretty effective in treating trauma, which I did not know. I know you work a lot with veterans and have in the past. Have you seen great results treating veterans with this? And does the VA use any acupuncture?
The VA, far as I know, they do have an acupuncturist on their staff. I have not heard them using AcuDetox within their facility. However, I can speak of one agency here in Colorado Springs that works with veterans, and them and me are actually working. They're trying to have me come over and providing AcuDetox to their veterans. They were doing that, and they were seeing that individuals were having less issues coming up, that when they were going into treatment, that they were becoming calm. Some of them even saying they have not slept that well prior to their military service.
Wow. And one last one, is it hard to convince clients to do this? I remember when I was in treatment, this was offered and I didn't take advantage of it. I was initially skeptical. I hadn't read any research or anything like that. It was just kind of a layman in coming at it. Do you find that people are resistant to this?
I've had a coin toss of, normally I've had some people, they're curious about this and they don't know what to expect. And some individuals, especially those that use substances through an IV, are very nervous about needles with another individual. However, I always invite them to, if they're not going to have needles, the acupuncture needles put into their ear, I want them to still sit in the group and to practice and learning how to sit with their emotions, get the benefit of the breathing exercises and the meditation. And sometimes once they see someone else, that's how they're doing it, they may see, oh, I've had individuals, they'll start that way. Before the end of it, they're like, they want to try it. And then they keep coming back.
It's a nice vote of confidence. Do you have any questions out there from anyone else? You don't have to unmute or come on video if you don't want to. Okay, well, we can close it up then. I want to thank everyone for attending. We will be posting this video to YouTube, and Laura will be sending out the slides with Kellyanne's contact information as well. So thank you very much for joining. You guys all have a great and safe holiday, and thanks for taking the time to do this, Kellyanne.
Thank you. And you guys enjoy your weekend and stay safe and warm out there.